last component of my talk, that is nursing process. As I am a nursing faculty, I have included this nursing process also. I don't know how many nursing faculties or nursing personnel have connected. Nursing process, it contains 5 components. First part is assessment and diagnosis and planning, goals and interventions, and last one is evaluation part. So first one is assessment part. Both subjective as well as the objective data should be collected from the patient by proper collecting history from the patient, because when you collect the history, many things like many patients don't want to reveal some unhealthy lifestyle or practices. So if we make a good rapport with the patient, and the patient can explore all the details with the healthcare personnel, so through that the data can be collected, and by doing proper physical examination and like by observing the ECG rhythm, which type of dysarrhythmias, and whether it is a sinus bradycardia or tachycardia, or whether ventricular dysarrhythmias, that is a lethal dysarrhythmias, that can be identified through proper assessment. So once after collecting the history and physical examination, we like a proper one conclusion we can get, that is nursing diagnosis. So we must make a nursing diagnosis, that is decreased cardiac output, because maximum all cardiac dysarrhythmias will end in decreased cardiac output, because ineffective cardiac contraction and sometimes slow cardiac conduction, or decreased heartbeat or increased heartbeat, ultimately it will result in decreased cardiac output. So the nursing diagnosis is decreased cardiac output related to disease condition or cardiac dysrhythmias, as evidenced by chest pain or dyspnea, etc. And anxiety related to fear of the unknown. Many people, like when you reveal the patients that you are having cardiac diseases or cardiac dysrhythmias, they will initial response, they may have anxiety and psychological fear and anxiety. So that also should be included in nursing diagnosis. That is anxiety related to fear of the unknown. Third one is deficient knowledge about the dysarrhythmias and treatment. So these are the common 3 nursing diagnoses I have made in cardiac dysarrhythmias. Once making nursing diagnosis, planning and goal. So planning goal, what will be our goal, whether it is a short-term goal or a long-term goal. So based on the nursing diagnosis, the goal should be formulated. So first one is eradicating or decreasing the incidence of dysarrhythmias, and second one is acquire knowledge about the dysarrhythmia and treatment. So this would be our goal. If the patient doesn't have proper knowledge about the cardiac dysarrhythmias, so nurses and medical people responsibility, we must make the patient to gain adequate knowledge regarding dysarrhythmias and the proper treatment. Then only the patient can be free from the stress and also the further complications of the complication can be prevented. And interventions like medication should be given properly. So we must encourage the patient to take the medications regularly, because if the patient doesn't have proper aware about the treatment modalities, they may skip the medication, but they should be insisted properly to the patient to take the medication properly. And main important thing, many etiological factors are related to unhealthy lifestyle practices, like a dietary pattern or physical inactivity and stress, etc. So these kind of unhealthy lifestyle practices need to be modified, and anxiety also should be minimized. And finally, evaluation part, once after providing proper intervention to the patient, and we have to recheck or by doing the proper assessment whether our goal has been achieved or not. So the expected outcome, like in nursing diagnosis, we have made that decreased cardiac output. So the after doing interventions, we have to examine whether the cardiac output is being increased or not. So that is our expected outcome. And experiences reduced anxiety and expresses understanding of the dysarrhythmias and its treatment. This would be the expected outcomes we must see in the patient. Thank you.